Hello and welcome once again to another episode of From the Heart. As always, this show is brought to you by the West Virginia Library Television Network and the American Heart Association. I'm your host, Kevin Pauley, Marketing and Communications Director for the American Heart Association. Well, as we've talked about many times on this show, our advocacy work, especially with our You're the Cure network, is something that continues to be an important facet of what we do when bringing the mission to life here in West Virginia. Of course, this being our centennial year, it's 100 years now of work with the American Heart Association nationwide, and here in West Virginia, it's no different. We're constantly trying to find ways to move the needle in regards to public health and how we can have people live longer, healthier, and happier lives. Now, our advocacy work is a major component of that, trying to help get passage of important legislation that can help move the needle in so many different ways. And today we're going to talk about a massive piece of legislature that we just got passed here in West Virginia with our very special guest, Government Relations Director for the Association, Emily Hanna. Emily, thank you so much for stopping by to be with us in the studio today.
Thanks for having me, Kevin. I'm glad to be here.
It's been a very exciting year because, I mean, this is your first session with us.
It is. It's my first year with AHA,
Right.
My first legislative session in this role, and taking on some of our biggest national priorities. It's been a really exciting year.
What a time to come on, man. Just in time for the centennial. It's like, I mean, like trial by fire, basically, at this point, right?
A lot of excitement, a lot of good energy, though, pushing things forward. So, yeah, it's a great time to join.
One thing about it, the centennial has definitely had people like thinking of us in an even more positive light than usual, because that realization of 100 years, like that's been a tick.
It's incredible. And to look at where the organization started,
yes,
and what was going on with cardiac and heart health back then, and how far we've come in the science and the research and the patient outcomes, it truly is an exciting time to reflect and to look forward.
Absolutely it is. And, you know, with looking at that looking forward, you know, looking at what you do with the field of government relations. Talk to us a little bit about like what all that entails, because it just sounds kind of, it's a nebulous statement to say government relations. Like, what does that mean? Tell us a little bit about, you know, what you do and how you're trying to help improve these outcomes here in West Virginia.
Sure. So, I mean, as you know, the government relations portion is embedded in our advocacy team, as you mentioned, and West Virginia is part of the Eastern States team. And so for us, when we talk about government relations, we talk about both state and local priorities.
Right.
So we work at the state or administrative or legislative level to advance policies that are backed by science and data from our research team, and put those at the forefront of public health initiatives here in West Virginia. But we also have very important work at the local levels, at the community levels, working closely with our community impact director,
Absolutely,
Holly Mitchell, making sure our work aligns, and then also working with city and county governments on issues, you know, like smoke-free air or youth vaping and tobacco.
Right.
Tobacco funding, so for prevention and cessation, and then in some of the cardiac emergency response plan work that we'll talk about, you know, there's opportunity for action there with universities and K through 12 schools. So it's various levels in West Virginia. And then, of course, we do have a federal government relations team.
Yes, we do. And we even have a federal lobby day and all that good stuff.
Yes,
so, yes,
exactly.
it is definitely nationwide. You know, one of the things I think it's important to address is, you know, we talk about trying to make change, and especially like in an election year like this, we always think about, you know, like the presidential election, and we think about, you know, our Congress. But, you know, most of the major change that people want is going to happen in these local and state elections. That's where truly the difference is being made in your community, correct? I mean,
right. I mean, in our day-to-day lives, we are most impacted by those local laws, those local lawmakers. You know, when you think about things outside of the Heart Association, whether it's your trash pickup, or local social services, or whether or not you can smoke in a restaurant, most of those laws and regulations, those services are provided at the local level. So it's super important to educate ourselves and to look to those local and community opportunities to get involved.
Yeah, it really is like one of those things where if you really want to make an impact, you got to start local and then work your way up. And really and truly, it's those local elections that will have major outcomes, and it's working with those local politicians and organizations that we do see so much growth. Because, you know, in the time that I've been here, you know, which, gosh, it'll be 19 years in June, which is nuts. But in that time, it's amazing the things we've been able to do with like state legislation and how, what we've been able to do with the cities. You know, just those kinds of ordinances, you know, making sure that we don't lose the ability for people to go into a restaurant and not be bombarded with smoke, you know, simple things like that. But then also things like pulse oximetry tests, you know, it's a simple thing that they put on a baby's finger when their baby is born, but it was not a mandatory thing. And we ended up getting that pressed as an actual law that now every baby born in the state of West Virginia will have that test done, and that can detect a congenital heart defect that could have been missed in utero. And it's a simple thing, but that is how you make a difference on a local level. And I love the fact that we've been able to see just over the years that kind of difference being made. One of the things we definitely talk about in a state like West Virginia is CPR.
Absolutely.
And we'll get into now talking a little bit about the cardiac emergency response plans. But I really wanted to talk about, just starting off though, one of the things we were able to get done was the fact that every West Virginia high school student is required to have some form of CPR training before they graduate.
Yes.
And that is such a critical thing in such a rural state. Talk a little bit about that, because like the importance of the more people we have knowing CPR, I just feel like the better we all are.
Absolutely. Well, with the AHA, we have our Nation of Lifesavers movement.
Exactly.
And that has, one of the goals is to reduce or increase the survival rate from cardiac arrest, to double the survival rate. And part of that is making sure that anyone anywhere is empowered to perform CPR should they need to.
Right.
Because we know that each minute that goes by when someone is experiencing a cardiac arrest decreases, if they don't get CPR, it decreases their chance of survival by 10% per minute.
Right. Within 5 minutes, you got a 50-50 shot of making it.
Exactly. And so when we look at a rural state in like West Virginia, where we don't always have all of the resources, where response times can be slower.
Absolutely.
Then that just increases the need for bystanders or folks that are close by to be able to know to call 911, to start CPR. And another bill that we passed, I believe several years ago, was making sure that EMS could coach through the phone in case someone didn't know how to do CPR. So if we empower our students in high school to graduate with that knowledge, and we empower our EMS communications to know how to train folks on that, then we are that much better prepared to respond to cardiac emergencies in our state.
The chain of emergency is really what it's all about. You know, years ago, we were finally able to get Mission Lifeline going in West Virginia, which was a massive win, because now all the hospitals, all the EMT services groups, they're all on the same page. So like when 911 is called, there's that chain of activation, and everybody knows what to do, where to go, who needs to do what. And that is, you cannot put too fine a point on what that means, especially in our more rural areas. And now here we are with a major win for you this year, your first session, and what a big win to come out with the Cardiac Emergency Response Plan, CERP. Talk with us about this, because this is one of those things where it just feels like this should have been something we were already doing.
Sure.
And yet it absolutely wasn't. And now we've got things to really make this happen. So talk about first, what is the bill? What does it mean to say Cardiac Emergency Response Plan?
Yes, absolutely. So for us this year, it was Senate Bill 602. We had great legislative champions, Senator Grady, Delegate Tully, Delegate Summers, to champion the bill for us. And so what it is establishing cardiac emergency response plans. Now, West Virginia, to give West Virginia credit, did have some existing emergency action plans for athletics. And that really laid the groundwork and did some ground softening for us. But what it does is a cardiac emergency response plan, or a CERP, is a written set of guidelines that, in this case, a school would use. They would post it, they would develop it in coordination with local EMS, with the staff and school personnel at the institution, and then they would have drills. They would make sure that they know exactly who is the point person on CPR, exactly who the point person is to call 911, who meets EMS at the door, where the AED is located, how many AEDs they need, have they been properly maintained, how to use the AED, and how to carry out each vital step in that chain of survival information, you know, that we need to do in the event of a cardiac emergency.
Now, this plan, obviously, it's special for each group, but I mean, the concept is going to be about the same. Knowing to call 911, knowing where everything's located, who's in charge of what. And that is something that I think is so important, because when a cardiac emergency happens, everybody's freaking out, right?
Yes.
Like everybody's nervous. They don't know what to do. They get panicked. Now they know exactly what to do when that comes into play.
Exactly. In a crisis situation, especially involving children, it's a normal response to kind of panic. And so what this does, especially when they practice it with drills, like we practice a fire drill,
right, exactly,
or any type of weather drill, people, once they practice it, it becomes part of their memory, part of their muscle memory even.
And that's important.
Yes. And so they know exactly what to do instinctively, because like we said earlier, every single minute counts.
Absolutely. And you know, the heartbreaking thing is to think of like if a child were to drop from a cardiac arrest, and you know, we see across the country, we've seen such an uptick in high school athletes, you know, who have had cardiac arrest on the basketball court or on the football field. And we had a very unique story here in West Virginia that I know was our driving force in getting this bill moved, and that was with Griffin. Take us through that story, because that is one of those things where I would have, again, I've been here almost 19 years. I've never heard of a case like this. It literally shook me to my core when you guys told me about it. I was stunned. Talk a bit about this case, because this really was for us, like, this is the spotlight as to why this is so critical.
Yes, absolutely. Griffin and his story is exactly why we do things like this. So Griffin is a 3rd grade student here in West Virginia, and his family have been absolutely incredible.
Outstanding. Absolute rock stars.
Right,
Absolute
since his recovery. So Griffin in the 3rd grade in a PE class, actually, he experienced a sudden cardiac arrest.
Gosh.
And they were fortunate at that school to have an AED that had been donated by a foundation founded by a father who had lost his daughter to a cardiac arrest. And so they had a donated AED, and they knew how to use it. And the staff at that school acted quickly and instinctively to start CPR, call 911, use the AED when necessary. And EMS responded quickly and jumped in and knew exactly what to do to save Griffin. Griffin was transported to a local hospital and then had to be transported out of state and had a long recovery. But since his recovery, he is thriving. He participated in our Kids Heart Challenge, and he is working now with becoming a youth advocate. And he came during the legislative session, and it was so special. He met with Speaker Hanshaw and with Senate President Blair, and those were absolutely beautiful moments where he could share his experience with people who have the power to make change in our state, to save other children like Griffin.
You know, the thing that really hit me with his story, and his mom talked about it, was that when they arrived in Cincinnati at the Cincinnati Children's Hospital, that the doctor told them that normally when he sees a child who's gone through what Griffin's gone through, that child shows up intubated and probably like unconscious. And he literally praised the people at his school for saying, because everybody knew what to do and did what they were supposed to do, Griffin is alive and talking to me. Like, he's not intubated, he is awake, he is talking to us, and we are going to get him where he needs to be. And that to me was what really, if nothing else solidifies you on the concept of why a CERP is important, that to me is all you have to say. That kid was talking, he was awake. When like 99 out of 100 times, that's not the case. That was an amazing thing to me. And that was what, when we started talking about what CERPs were, I was like, this is a no-brainer. Like, this needs to happen. You know, obviously, though, you put a bill out there. That doesn't necessarily mean it's going to pass. I mean, it takes time. What was the process in getting the bill passed? Was there much pushback on it? I mean, it seems like this is one that, I don't care what side of the aisle you're on, everybody wants to help kids, right?
Right. Children should be a nonpartisan,
yeah, it doesn't matter what
issue.
Letter beside your name, right?
You know, but like anything that goes through the bill-making process, you have to consider things like the fiscal impact and all of the departments involved. But we had wonderful support this year from the Department of Education, from people who actually were aware of Griffin's story and how important it was. So for us, we introduced a Senate and a House version of the bill. Both proceeded through the committees We testified before committee. We had lots of support ready from our advocates, from our grassroots. But we really had those amazing legislative champions that carried the bill for us.
Sure.
They passed both houses without opposition, and we were very excited about that. And we got that groundwork laid this year for school athletics. And we're going to come back next year. We're going to come back with Griffin. We're going to come back with our advocates and our legislative champions. And we want to see it expanded beyond just school athletics.
Absolutely. I mean, athletics, though, is a big win because
Huge.
they're so huge in this state.
Yes.
And in so many communities, like the school football team or basketball, like that's what the community rallies behind. That is an excellent start.
It is.
It is an excellent start, and it's absolutely a win. On that note, we were able to have a very special ceremony.
We were.
With the actual passage of the bill and the signing of the bill. And we've got some photos here we're going to pull up. That is in the middle there. Of course, you know Governor Justice, and of course, we all know Baby Dog. And let's be honest, she was the most important thing in the room.
She stole the show.
Next to that sweet little boy in the middle of that picture, and that is Griffin. And he was so excited, and there's his family, and there are members of the association. So many people came out to support this bill. And the awesome thing was just getting to watch Griffin be a normal little kid.
Yeah.
He was so excited to meet Baby Dog. He could not wait. Governor Justice actually had him sign his name for him. And you see right there, him signing Governor Justice's name. And it was just an absolutely just sweet moment. It was one of those things where I'm so glad that we got to do that. And I'm so glad that Griffin and his family got to experience that. For you, this being your first session, this being such a massive win, and obviously you worked very closely with Griffin's family, what did it mean to you to see this day finally come?
That was a very emotional day for me and for Griffin's mom. Governor Justice and his staff were so wonderful.
Oh, they were incredible.
They were so gracious, and to bring Baby Dog, because we had several children there who were excited to support the initiative, and it just meant a lot. You know, it was a wonderful day to celebrate how far we've come in advancing heart health in West Virginia and protecting our children and protecting our young athletes. And to see Griffin there thriving and excited to meet Governor Justice and excited to see Baby Dog, it was an incredible moment.
I think for me, like that was the beautiful thing, was that Griffin was not there necessarily as a cardiac survivor.
No.
He was just there as a third grader
who
was happy to meet the governor, and more importantly, happy to meet Baby Dog. And that was such a precious moment. I mean, it really was. It's why we do what we do. When you get a win like that, and you get to see him, and he's just getting to be a normal kid. That for me is what it's really always about. On the special topic of children and talking about our grassroots and advocates, we had two members of the state's first ever youth advocacy committee join us at that signing, and they were able to put together some reels for us. We'll pull those up right now. You'll see Delaney Roberts and Jahari Barron, two of the most driven and incredible kids. Oh, and there is Hillary Gore as well. Hillary joined us on our actual advocacy day, where we were first pitching CERP.
Yes.
And Hillary, a phenomenal national spokeswoman for us, shared her thoughts on the importance of the bill. You can see there everything is captioned, so you can see what she was saying. And for Hillary, it was really important for her to see it living in a more rural area. She thought it was great to see this kind of thing happening in West Virginia, and was absolutely passionate about seeing it happen. Hillary's been a phenomenal advocate for us for years, a member of the Kids Heart Challenge and American Heart Challenge. There's Jahari Barron. Jahari, of course, he not only is an advocate, but he and his mom have their own nonprofit called Hearts United, and they go out and teach CPR.
That's amazing.
And so for them to see this happen was such a big deal. Jahari was so excited to see this come to fruition. And as someone who understands firsthand the importance of CPR, by going out and teaching it.
Absolutely.
There was like no better person to be there. And then Delaney Roberts has been a heart healthy hunting advocate for us.
Yes.
An absolute gem of a spokeswoman for that campaign, who lost family members to cardiac issues from hunting. And so for her, this was also very important to see. And even in her community, a 10-year-old girl had lost her life during a sudden cardiac event. So obviously it's something that is, you don't ever want to see it happen. But if it were to happen, you take comfort in knowing that there are plans like this in place to make sure that the outcome is definitely a more positive one.
Yes.
Obviously this was the first year looking at it from the school athletics. What is the next step? Where do you see it moving in the next direction for like the next session, let's say?
Yes. So nationally, we have a lot of momentum behind us with our Smart Heart Sports Coalition, with the NFL and the NHL and all of our partners. And so, yes, we do see that focus on school athletics and athletics generally. And so where we see it moving next year is expanding beyond athletics in our K through 12 school system.
Right.
We'd like to see it in all schools, regardless of their athletic department. We'd like to see an increase in AEDs, because we know that an AED on one side of the school might not be the best location if something happens on the other side of the school.
Right.
And so we'd like to see a huge focus on making sure that all of our schools are prepared to keep not only our students safe, but anyone who enters that school property, whether it's a grandparent, a teacher, anyone who's employed in that school system.
If you're hosting a game, anybody who comes in to watch that team play on the field or watch them on the court, you just don't know. You truly don't know.
Or just like in Griffin's case, in PE class.
Right.
Yes.
Right.
So our next step is to expand it to all schools in West Virginia and to make sure we have the support, funding, and resources necessary to do that. As you know, the AHA is always founded in research and science and data, and sometimes it's hard to keep track of all the data just off the top of my head. But one statistic I do know is that children in the United States, 23,000 children experience sudden cardiac arrest each year.
Wow.
And only 40%, not only, but 40% of those are athletic related. So 60% are occurring outside of
athletics.
Yes, exactly. And another statistic we know is that when a school has an AED, the chance of survival increases 7-fold.
Wow.
So we go from a 10% survival rate to a 70%.
That's a big enough difference to take. That gets your attention.
It does.
I mean, that really does.
It absolutely does.
And AEDs, it's definitely one of those things that if a building can have an AED, I've always said if you can afford to get one, get one, because they've come down significantly in price from what they used to be. And you can even get refurbished ones and stuff. But I will say it is one of those things that you see it, and when you go through the training, it's so easy, because it literally tells you exactly what to do.
Talks you through
it will not administer a shock unless everything is correct and unless it's absolutely necessary. It will not even let you do it unless it is actually needed. So you can't mess that up. Like it's literally just follow the directions. It will tell you everything you need to know. And as you said, we passed the TCPR bill. So when you call 911, they can talk you through doing CPR right there on the phone.
Yes.
So again, you've got everything in your favor. Just take the time to learn. And the great thing is, of course, every one of our high school students who are graduating have had some form of training. And the more we have these CERPs in place in schools, that means the more people are trained. And it's not just students, it's faculty and staff, so that everybody is aware. And those things are just so critical. As we're moving forward, obviously next session will be next year, but people can still get involved. So talk a little bit about our You're the Cure network, because that is really the way to get your voice heard. And it's really, really simple. And more importantly, putting this out there, it's free. Let's always remember that it is absolutely free to join.
It's absolutely free and easy to join. You can go on our website, you'rethecure.org.
Yes, yourethecure.org.
Okay. Put in your information. It'll ask you a couple of questions about what your particular interests in.
Yes, what your passions are.
Yes, relating to the American Heart Association. You don't have to pick everything.
No.
If tobacco is your area of expertise or where you want to learn more about, check tobacco. If you want to work with school children or learn more about what we're doing with the NFL, You're the Cure is that awesome spot to register your information, and then you can control how much you receive. It makes you aware of our local events that are going on.
Absolutely.
So how to get involved. It'll give you legislative alerts, so you know what's going on at our state house, so you know what we're working on and what the goals of the legislature are. Sometimes we host grassroots trainings.
Yes, they do.
So we have wonderful support there. And so, yeah, You're the Cure is an absolute easy.
Really, easy and free. I mean, like the two things we love the most about anything, they're easy and free.
And it's also easy to control if you want to change it. If you're saying, hey, I want to get more involved, I'd like to learn more about your different policy areas, you can do that. And if you say, hey, wait, information overload, I need to back off, super user-friendly.
You can do that too, absolutely. Yes. The other thing I love about it too is, I mean, really, if you want to make your voice heard, and we're saying, hey, tell someone, tell your elected official that you care about this thing. You get a pre-tailored email that you can add your own special take on, or you don't have to do that at all. And as soon as you hit the little button to submit, it tells you exactly which of your elected officials it went to. It knows where, because the information we have will tell us what district you're in and who your elected officials are. It takes care of all of that in one fell swoop. All you have to do is click a button. I mean, it's so simple.
Yes, and it's a great way to get involved in advocacy.
It's a great way, and like you said, your voice is heard, and it allows you to figure out what we're doing as well. So if you want to join us for a lobby day, come join us. The information will be there. Come let us know you're going to be there. There's so many ways to get involved.
Absolutely.
That it really is. It's a great tool, and I can tell you that we hear from our elected officials that they hear from their constituents from Year of the Cure, and it does make a difference.
Absolutely.
Your voice is absolutely being heard, and it don't think for a second that it just goes off into the, just the cloud. No, it actually goes into the email of the right person. And I'm always amazed how many responses I get. Like I get immediate, like, thank you for taking time to, this is what we're doing. And they really do pay attention, and that's an awesome thing to see.
They do. Some of our legislators are registered in You're the Cure. And so I love it when we send out an alert and the legislators respond, hey, I can't make it that day, but stop by my office.
Yes.
It's really reassuring, and it's great to just know we have those allies out there.
It really is. And again, it's simple, it's quick, it's easy, it's free, but it is a great way to have your voice heard. And again, we remind you, if you have not done this, go to you'rethecure.org. You can do it today. You can get signed up very, very quickly. And the next thing you know, you're part of the team. As we're wrapping things up, Emily, again, a tremendous session for you. A tremendous win for the state with CERP.
Yeah.
Thoughts going forward? What are you excited for next steps?
Well, I'm really excited that West Virginia is actually leading the nation in something positive.
Top three.
One of the first three states to pass this comprehensive legislation. And so I'm incredibly proud of our state government, of our governor, of our team for pushing this forward so quickly to get our students and faculty safer.
Yes.
So huge shout out there. So I'm really excited about that. Looking forward, I'm excited about continuing the work, about providing that support to schools who want to have their own cardiac emergency response plan, who need a little bit of assistance in learning about AEDs and that type of stuff. And as always, we will continue to do the good fight with increasing prevention and cessation treatment for those who wish to stop the use of tobacco and vaping. We'll continue to look at our youth vaping numbers and see what we can do to tackle that. And then continue to do the really good work of advocating for Medicaid coverage of self-monitored blood pressure.
Yes. Yes, yes, yes. That is so critical. In a state that is a national leader in hypertension, it is so important to have that there. Well, Emily, again, congratulations on a tremendous first session, and thank you for fighting the good fight to make a fantastic policy happen that is really going to help move the needle and does make an absolute difference. Thank you for all you've done, and we look forward to working with you on an even safer West Virginia in the very near future. Well, that will bring this episode of From the Heart to a close. And again, if you're interested in what we've talked about today, you can, again, join the You're the Cure network at you'rethecure.org. And of course, you can follow us online at Facebook with facebook.com/AHAWV. And on Instagram and Twitter, or X, whichever you prefer, it is at AHA_WV. Helping keep you informed on the Library Television Network, I'm Kevin Polly. Here's wishing you good health for a happy heart.